I think we have a couple of minutes for Q&A, and we have some questions coming in from Slido. If you have any other questions, feel free to also scan the QR code on the screen to submit them.
Can I start? Okay, the first question, who are newly diagnosed with blood cancer, so what are the biggest concerns you typically see? So if for physician perspective is how fit is the patient, right? So not all 70s are the same. Some 70, like the one I showed just now, he still cycle like 20-30 km every weekend. So those are the fit one. So for me, from physician perspective, is the fitness of patient, and for patient perspective, of course, is first is the diagnosis. Secondly, know why are we so fearful of all the diagnoses, because it comes with a financial burden as well, right? So of course that's a practical thing, and of course the outcome as well is what the patients are mainly fearful of lah. So we are very honest with patient, what we can do and what are the expectation, and of course the rest is actually the fitness of patient, right? So these are the few perspective that we see in the patient, and of course the patient's aim, or what are they looking at with this diagnosis, or patient preference, the family preference as well. So these are the few things we look at. But for physician, it's actually the fitness of patient. Of course, we look at the biology of patient as well, whether they are fit enough to receive this targeted treatment or immunochemotherapy. So with so many options available today, how do doctors decide which is the most suitable for each patient? Of course, each patient, we don't, we know what is a standard. Of course, we also knew there are newer data available. For current age, it's in Singapore perspective, it's very easy. It's based on the cancer drug list. Yeah. But if you ask me, there are newer treatment available. So we always tell patients, these are the first thing you need to do. Of course, there are other options available if this didn't go through. But you always keep quite updated with the latest development. That's why I can tell you so many things that, they are coming. Okay, so if there's any patient, is there anything people can do to reduce the risk of blood cancer, or are they not preventable? So this is a question that I usually try not to answer, because the sad thing about lymphoma, some of it can be prevented, like some associated with viruses, and but myeloma is an aging process. As you age more, sometimes you accumulate the genetic mutation. So these are not preventable. Acute leukemia, sometimes we know they may be preventable, like some of the toxic agent, pesticide. When I went to, we used to travel a lot. I went to Bangladesh. They told me the number one cancer in Bangladesh, acute leukemia. I had a shock. Acute leukemia, not other blood cancer, not other tumor, but it's acute leukemia. So I think part of it is environmental. So those are the things that can be prevented. But yes, some of it not prevented. But not prevented doesn't mean you should just live, free and easy. The healthy lifestyle is important, because you can see that my first impression of when we see patient is the fitness of patient. You need to eat well, maintain your health fitness. That will actually open up your options for more treatment more treatment that the patient can receive. So what are the prospect of getting BCMA directed CAR-T to relapse refractory myeloma approved? So this, I don't know who asked this question. This is a difficult question, because there are a lot of regulatory behind this as well. I always work closely with the government to get this thing in. Okay, thank you very much.
Okay, thank you so much, Dr. Lee.